Imagine a world where over 284 million people grapple with an invisible adversary, anxiety. That's right, anxiety, a common mental health disorder, affects a significant portion of our global population. So, what is anxiety? Anxiety is a normal and often healthy emotion. However, when a person regularly feels disproportionate levels of anxiety, it might become a medical disorder. It's characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. Let's delve a bit deeper into what happens in our brain when we experience anxiety. Essentially, anxiety is a fear response, and it's triggered by excitatory neurotransmitters such as sodium, serotonin, and dopamine. These neurotransmitters are chemicals that transmit signals in the brain, and when their balance is skewed, it can lead to feelings of anxiety. Understanding these biological aspects can help us manage and treat anxiety disorders more effectively. So, anxiety is not just an emotional state, but a complex interplay of chemicals in our brain. By understanding the science behind it, we can better empathize with those suffering from it and work towards effective solutions. Now, anxiety doesn't come in a one-size-fits-all package. It manifests in several forms, each with its unique characteristics. On one hand, there's generalized anxiety disorder, where one experiences excessive, exaggerated anxiety and worry about everyday life events. Then we have panic disorder, a condition marked by recurring, unexpected panic attacks with peaks of intense fear and discomfort. Next on the list is social anxiety disorder, characterized by an overwhelming fear of social situations. Then we have specific phobias, an intense fear of a specific object or situation. Lastly, there's separation anxiety disorder, a condition where the fear of being parted from loved ones takes a toll on one's mental health. In our exploration of anxiety disorders, another form that needs our attention is obsessive-compulsive disorder, or more commonly known as OCD. OCD is a unique form of anxiety characterized by unreasonable thoughts and fears, also known as obsessions, which lead to compulsive behaviors. These compulsions can range from excessive hand-washing or cleaning to repetitive checking, counting, or arranging objects. The fear of not performing these rituals can, in turn, cause significant anxiety. While OCD can be debilitating, causing distress and interfering with daily life, it's important to remember that with treatment, you can regain control over your life. In the end, OCD is a chronic disorder, but with the right treatment, it can be managed effectively, allowing individuals to live fulfilling lives. But anxiety doesn't have to be a lifelong sentence. There's a range of drugs available to manage and treat anxiety disorders. The most common ones include selective serotonin reuptake inhibitors, or SSRIs, like fluoxetine and sertraline. SSRIs work by increasing the level of serotonin, a neurotransmitter in the brain that helps regulate mood. Another common class of drugs is benzodiazepines like diazepam and alprazolam. These drugs work by enhancing the effect of a neurotransmitter called GABA in the brain, resulting in sedative, anti-anxiety effects. However, they can lead to dependence and withdrawal symptoms if used long-term. There's also the class of drugs known as beta blockers, like propranolol. These are traditionally used to treat heart conditions but can also be used off-label to relieve physical symptoms of anxiety. Another class of drugs that can be used to treat anxiety disorders is barbiturates. These are sedative hypnotics, drugs that depress or slow down the body's functions. They're less commonly used today, but in certain cases, they may be prescribed for short-term relief of acute symptoms of anxiety. Barbiturates work by increasing the activity of GABA, a chemical in the brain that helps to calm the nervous system. However, they come with their own set of drawbacks. They have a high potential for physical and psychological dependence, and they can be lethal in overdose. Despite their potential risks, when used responsibly and under the guidance of a healthcare professional, barbiturates can be effective for short-term relief of acute symptoms of anxiety. It's important to remember that the treatment for anxiety is very individual. What works best will depend on the person and the type of anxiety they are dealing with. However, it's important to remember that all these drugs come with potential side effects. SSRIs can cause insomnia, skin rashes, and weight gain. Benzodiazepines can result in drowsiness, dizziness, and confusion. Beta blockers can cause cold hands, fatigue, and a slow heartbeat. In conclusion, anxiety is a complex mental health disorder that affects millions globally. It presents in various forms, including generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobias, and separation anxiety disorder. A variety of drugs, such as SSRIs, benzodiazepines, and beta blockers, are available to treat these conditions. However, these drugs can have potential side effects, making it crucial for individuals to consult with healthcare professionals before starting any treatment. As we wrap up, we'd like to remind you that while this video provides valuable insights into anxiety and its treatments, it's not a substitute for professional medical advice. Always consult with a healthcare professional for your medical concerns. If you found this video informative and helpful, don't forget to give us a thumbs up, share it with your friends, and subscribe to our channel for more enlightening videos like this one. Remember, understanding is the first step to managing anxiety. Let's continue the conversation and break the stigma around mental health together. Thank you for watching. Stay healthy, stay informed.